Good evening. Welcome to Facebook Live here from Door County Medical Center. I'm Dr. Jim Heise, Chief Medical Officer. And the person sitting to my right is not Sue Powers, Public Health Manager. It, in fact, is our CEO, Brian Stevens. Welcome, Brian.
Well, thank you, Dr. Heise. I appreciate you having me on the Facebook Live. And,
Absolutely.
You've been in the hot seat for, we said, nearly a year now. So
yeah.
It's about time that you put me under the spotlight.
There
right?
we go. There we go.
So.
Yeah, and Sue would be here, but she apparently has gone to some exotic location on vacation. Did you hear where she's going?
I had heard that she's painting her basement.
I see. Okay,
Yeah.
So maybe not so exotic.
Not so exotic.
But nonetheless, anyway, so what we're going to do is we obviously want to talk about vaccinations. That's kind of what's paramount on everyone's mind. And obviously for many it's been a frustration. For equally many, it's been almost giddy excitement that they've been able to get their vaccine. We're going to talk this evening about what's happening, what the situation is from the state perspective, and we'll answer whatever questions you have to the best of our ability. We got some good news today from Public Health that they received 361st doses this week, which is going to allow them to completely complete their wait list. So they're going to be starting they'll be opening it up to more vaccines. And that really is kind of part and parcel of what we want to say as a main message, which is when you can get the vaccine, get it. It doesn't matter where you get it. It doesn't matter which vaccine, get the vaccine. I think what we'll do while I get the computer all set up and ready to go is I'm going to ask Brian to kind of give us an overview as to where we are. Kind of spread the good news about what's happening with our numbers.
I will definitely do that. And I do want to start just by saying thank you to you and a public thank you to Sue Powers for the many months that you've done this. And I think it's been an invaluable resource certainly I know to my family. We've been tuning in to all of these and always learn a lot. It gives people a chance to ask you questions, and we just appreciate all the advice that you've given us over the months. And so thank you for doing that, and thank you for having me on to be a part of it tonight. We do have, honestly, some good news to share in terms of the situation that we're at right now in the community. We've certainly seen a large reduction in cases over the last several weeks. The number that I've paid the most attention to in the last several months has been the active cases number in Door County. It's a number that each weekday Door County Public Health updates on their website. And we had run around, I think we peaked at around 800 active cases at one point in November. That was the highest that we ever had in Door County. And it fell down to around 300 cases in December and stayed right at 300 cases for a couple of months. And just in the last couple of weeks have we seen that number actually start to go down. I believe we're under 20 cases, something right in there. In the most recent numbers this week. So that's certainly a fantastic indicator that the number of positive cases or number of active cases at any given time has gone way, way down in our community. Our percent positive is down as well. Nationally, you're seeing the same thing. We've seen, I think you said, a 70-something% reduction in cases nationally over the last couple of weeks. So that's really tremendous. At the same time, we all heard the news today that as a nation, we topped 500,000 deaths from COVID-19. So we certainly don't want to minimize the impact of the pandemic, both on the health of the population and also financially and otherwise on our community. But certainly seeing a lot of positive signs and a lot of positive momentum. And, we're encouraged by that. And I think that it's a testament, certainly in our community, it's a testament to people doing the right things, doing the things that you and Sue have been asking them to do all along. And, wearing masks, socially distancing, and all of those things that are still wonderful and important precautions today.
Yeah, those are going to continue for a while. I mean, just because people are getting vaccinated doesn't mean that we'll be able to stop masking immediately. Soon enough, that will come. What we'll talk about now, I think we want to talk about the vaccines, vaccinations, and what really has been going on, because everyone knows that we've had to reschedule some people, cancel some folks. Public Health went through that a couple of weeks ago. So what I thought I might do, and I'm taking a little bit of a calculated risk, I don't want to bore you, I guess is the risk I'm talking about, is I want to read an article that Eric Borgerding, who is the head of Wisconsin Hospital Association, wrote. And I think he did a really good job of encapsulating what's going on. So if you'll indulge me, I'm just going to read this. It shouldn't take very long. It'll be less than three minutes or so. So it starts, just as they're doing with COVID testing, Wisconsin hospitals and health systems are again playing a critical role in the state's response to the pandemic. They're administering hundreds of thousands of COVID vaccines to Wisconsinites with the capacity to vaccinate many thousands more every single day. So why are appointments for vaccinations being canceled and delayed? The answer is frustratingly simple. Not enough vaccine is coming into Wisconsin. Hospitals, health systems, clinics, and pharmacies have requested 340,000 first doses of vaccine just for last week, according to state officials. But only a fraction of those requests, 71,000 doses, were fulfilled. Vaccine supplies are expected to improve a bit in the near term. That's the good news. But supplies will still fall short of demand, even as hospitals and others keep working to finish protecting people 65 and older who make up 90% of COVID deaths. Less than half of this older population has been vaccinated in many Wisconsin counties, and phone calls and appointment requests to hospitals, clinics, and health systems have not slowed down. Many of the more than 550,000 unvaccinated seniors in our state are reaching out for their turn. And on March 1st, Wisconsin is scheduled to make an additional 650,000 people eligible to receive their first dose of a 2-dose vaccine, widening the gap between supply and demand. Hospitals and health systems throughout Wisconsin have mobilized thousands of staff and allocated substantial funding, space, supplies, time, and operational resources to schedule and administer vaccines very quickly. They have already vaccinated hundreds of thousands, including seniors, frontline healthcare workers, and first responders. They're very willing and ready to vaccinate many thousands more. But instead, they're forced to cancel or not schedule thousands of appointments because vaccine supply and allocation is still falling far short of demand and capability. The current situation is frustrating and confusing to those still waiting for a vaccine and a return to a more normal life. Dedicated healthcare providers who have marshaled the resources to get shots into arms as quickly and safely as possible share that frustration. To be sure, Wisconsin has made notable progress from where we started just a few months ago. Yet our state is held back by vaccine production and allocation. State officials are doing what they can to bring more doses here, but those decisions are ultimately made in Washington, D.C. and elsewhere. Wisconsin's hospitals and health systems will continue giving as many vaccines as they get from the state. Until supply and distribution improve, they ask for patience from our communities and a stronger, more urgent response from those in charge of vaccine production and distribution. Hospitals and health systems are eager and able to serve their communities and vaccinate more of their patients, a lot more. So I think that sort of says it all as far as where we are when it comes to vaccines. Any comments on that you want to?
Well, you know, the state last week released a new vaccine graphic on their website, on the Department of Human Services website, and it shows each county in the state of Wisconsin and how far along they are on vaccinations. And the good news is that in Door County, we're actually doing quite well. Ever since they've released the data, you can see that we're in the top 10 out of 72 counties in terms of the percentage of the population who's been vaccinated. Mm-hmm. So we got off to a fast start in Door County. Kewaunee County has lagged behind a little bit. They're slightly below the state average, so not quite as good. And there's a number of reasons for the reason that Door County is where they are and the reason that Kewaunee County is where they are. But ultimately what it comes down to right now is every county would like to be moving faster. And as you said, a lot of it comes down to the production from Moderna and from Pfizer, as those are the two approved vaccines at this point. You and I both participated in a national conference last week, and I had the opportunity to ask a question of one of the federal representatives at the conference of, you know, are Moderna and Pfizer, are they hitting their marks? Are they delivering on everything that they promised in terms of their production? And at this point they are. Mm-hmm. The answer to that is yes. They've hit every mark that they've set. They have another big couple of targets coming up, one on March 1st and one at the end of March, to try to hit some production targets that they've promised to the federal government. But so far, they've hit all those marks. I think it's just a situation right now where the hype about the vaccine has just exceeded the supply at this point. And you know, that's natural and it makes sense because the vaccine's been so effective. You know, everybody wants to get it because they know it's been proven to be 95% effective. If you take into account that the remaining 5%, when they get sick, they don't get very sick. They're not hospitalized. There are no deaths, those sorts of things. It creates a situation where the demand for the vaccine is very, very high and just at this point exceeds how quickly they can produce it.
Exactly, exactly. So I think we've got some good questions here. So we'll start with a couple here as I look through. I'm going to jump to, we'll start with, Larry asks, what's the latest on carrying and transmitting the virus after full vaccination? And I think that's what a lot of people are wondering, and especially as it pertains to why do we have to keep masking if we've been vaccinated? And the answer is that the concept is that whenever you're vaccinated, no vaccine is 100% effective. And so as we talked about 95% efficacy, there's always that 5% chance that you may not, in fact, be fully protected against the virus. And so from that perspective, you have to be concerned about that. From the perspective of so you're vaccinated, could you give it to someone else? The answer is yes. It's possible that you get the vaccination, you can still become infected with coronavirus. The vaccine itself protects against disease. It does not protect against infection. As far as you're concerned, as someone who's vaccinated, it doesn't really matter to you whether you're protected against disease versus infection because the infection that you have is going to go away awfully quickly. The big issue is you could potentially spread that onto someone else who might have health problems and who might do very poorly. So that's kind of the reason that we're talking about wearing masks, at least on the short term. Brian, this might be a good, who determines the amount of vaccines that are distributed to Door County, being that we're one of the most aged counties in the state per capita? Who is ordering the amount of doses? I guess what I'm thinking about in response to that is the social determinant thing.
Yeah, in fact, the state has become more and more transparent over the last few weeks about how those allocation decisions are made. There's a couple of things that go into it that are impacting us. One is something called the Social Vulnerability Index, and that looks at things like socioeconomic factors. It looks at race. It looks at the number of people who tend to get certain types of diseases and those sorts of things within each county. In Door County, we're very fortunate to live in an area that is not hard hit by some of those things, or at least not as much as other parts of the state. In fact, if you look at how we rank on the Social Vulnerability Index, Door County as a region ranks 60th out of 72 counties on that index. And so one part of it is the state is trying to allocate as much vaccine as possible to those populations who might be more vulnerable. And in doing so, they may not be allocating quite as much to Door County. Now, where that argument falls down, though, before we get too excited about that, is when you look at the state map and you see how far ahead we are of other counties in terms of the percentage of our population that has received it. So that's a factor. Is it the only factor? It's obviously not. Otherwise, we wouldn't be where we are right now in terms of the people who have received the vaccine. The other thing is population statistics. They do look at it. I've not seen anything that says that they look specifically at the number of people over the age of 65 in your county. They look at the population statistics as a whole, but I don't know that they look at the over 65 population. There again, though, that said, nearly 45% of the residents of Door County over the age of 65 have already received at least their first dose of the vaccination. So we're doing quite well in that category, but those are some of the things that they're looking at.
Great, thanks. I always tell the story, people that know me, that both my parents are 81 years old and my mother has a chronic illness, and they are in the Milwaukee suburbs, and they are not vaccinated, and they're not scheduled to be vaccinated. They have no mechanism right now to get the vaccine. So they're working toward it. I mean, they're trying to wait for an appointment time to open up, but It's tough. It's tough everywhere. Here's a great question that Aaron asks, which I know is prime on the educator's mind, which is, can school staff sign up for an appointment yet? The answer is no, not as yet. We're going to wait until March 1st. There's some new information that came out that I'll ask Brian to expound upon a little bit more about how that might be run. But I think the message that I want to put forth is I know that the teachers especially are very much looking forward to being able to be vaccinated. And when we say March 1st, that's when that category, not just teachers, but there's a few other categories of folks that will be added on. That doesn't mean that come March 1st you can get your vaccine. That means that March 1st is when you can sign up. And we're into April already. So I guess that's going to be one more piece of patience that we'll have to muster as far as that's concerned. But you want to talk about what you just learned this afternoon?
Sure. Yeah, and a little bit of history and a snapshot. I'm a numbers guy, so hopefully I'm not going to throw too many numbers at you here. But just to give you an example of where we've been over the last couple of months with vaccine allocation and how we've determined, how many patients to schedule and that sort of thing. When we first started receiving the vaccination back at the end of December, early January, we were receiving about 600 doses a week here at Door County Medical Center. That happened for a few weeks, and then we went down to 500 one week, 350 the first week of February, and then each of the last 2 weeks we've received only 100 doses at Door County Medical Center. But that early period where we were receiving 600 doses a week, I think lulled us into the feeling that we were going to continue to receive at least that. I remember saying that to our team in this room. I remember saying, well, surely the supply is only going to grow from here.
Yeah.
And yet that's not been the case. It's actually because the total number of vaccinators has increased and the supply the state's getting has been the same over the last couple of months, our allocation has actually gone down. But with that kind of false assumption in the background, we started in late January scheduling about 500 people a week for first doses. And because our allocation has fallen well short of 500 the last few weeks, we've actually had to cancel appointments, put people on wait list. We now have a wait list of nearly 1,000 people to get through. And as you said, we have people scheduled out through mid-April to receive the vaccine. All of those folks are generally over the age of 65 or fall into one of the prior categories, a healthcare worker who hadn't received a vaccine yet or something to that effect. So these new groups are coming online March 1st. And just today, Public Health, our Door County Public Health, put out a press release that you mentioned already that indicates that they've worked their way, by the end of this week, will have worked their way through their waiting list, which is good news, and I think good news for educators as well. And then the state came out with some new information at 5:15 p.m. today, so right before we went on the air here. And it makes it very clear that they're expecting local public health departments to play a coordinating role in the vaccination of educators and child care personnel. And I think that works well here in Door County. I know we've tried to work very closely with public health. It looks like, based on their press release today, that they're actually going to have greater availability before we do in terms of being able to serve the educators and school district employees. And so I think that's what we're going to recommend is come March 1st, it would appear that public health is going to be able to reopen their link for people to go online and schedule appointments. And that's probably going to be the best approach for those of you who work in school districts, for teachers, to work with public health to try to sign up for a vaccination through them. Now, all this could change, right? Mm-hmm. Just like it has already. Early on, we were receiving plenty of vaccination and public health was not, and they were having to cancel and wait list appointments. If it were to flip back the other way, we would work very closely with public health and we would welcome the opportunity to vaccinate educators and others in school districts. And one thing we want you to know is, just like I said earlier, in full appreciation for everything that you and Sue have done, I think those of us at Door County Medical Center have nothing but appreciation and admiration for all of the teachers, all of the folks who have been working in grocery stores, the populations that are going to become eligible on March 1st, and we can go through those here in a moment, are people who have truly been on the front lines with us in healthcare throughout the last year. And so there's no doubt in my mind that we need to get all of you vaccinated as soon as possible. It's just a matter of who's going to have the vaccine to do it and who can do it most efficiently and most quickly in our community. And it looks like right now that it's going to be public health that can help with that the most. But we want to be there to play a supporting role and to help out if needed.
And we'll keep doing everything that we can, along with public health, to communicate whatever changes come along. One of the things that I've been doing with the help of our crack marketing team here at the hospital is on our website, dcmedical.org. Every week, when you go onto the site, on the lower right-hand corner, there's a little pop-up. It's a video. We call it Vaccine Corner, kind of tongue-in-cheek, and it's a very short, usually maybe 30 seconds, 45 seconds, where I'm saying we are still on phase 1B, which encompasses this and that, and so we're trying to use that as once a week or so. We'll change it more than once a week if there's things that change, but we're trying to use that as a clearinghouse so that if you want to know what's going on, where are we, that's something we can use, because I think one of the neat things about living in a small rural area is that, to Brian's point about the grocery store workers and everything else, these are all our neighbors and all of our friends and family, and so we really want to do our best to get the information out and keep the information current. And if we've learned nothing throughout this pandemic, it's that things change very rapidly. So we'll keep you posted. There's a couple of good questions I wanted to kind of rapid fire through, because I'm sure there are many that are thinking about them. Kathy asks, what about second dose vaccines that are scheduled for this week? Are they still being given? Yes. So if you're on a second dose, that's accounted for. As far as if your appointment was scheduled, someone asks, Lee asks, how do we know if we're still on the list for rescheduling? You're on the list. So we're kind of doing a wait list. And I don't know, do you want to talk about what we're doing as far as, I don't believe it's a situation someone else had asked about if there's not enough vaccine and if you are put on a wait list, do you go to the end of the line? That's not the case.
No. No, for us, it's been more of a domino effect. So like I say, we have nearly 1,000 people on a wait list now. And when we get the vaccine allocation, we will try to schedule those folks first and then bump other people who have appointments that week if necessary. Now, just so you know, we've created the capacity to give nearly 1,000 vaccine doses a week. And like I said earlier, we've only been getting an allocation of 100 doses a week. So we're well below our capacity of what we could do. So every week we request 1,000 doses. And if we were to actually get that from the state for whatever reason, production increases or whatever, we would be able to work through that wait list very quickly. So, but yeah, we're not sending people to the back of the line. We're taking the people at the top of the wait list, and those were people who were scheduled the earliest, and trying to fit them in as soon as we have the doses available. Yeah,
and I think Paul had asked the question, how do you determine how many? Basically, what we did from the start, and what Brian just said, is basically it has to do with how many vaccines can we give in a week, because what you have to understand too is that these vaccines, they come in vials that are about 10, 11 doses. And once you open the vial, you have to go through those. You don't have time. So we have to make sure we have at least 10 people for that vial. And you have so many days within which, after you take it out of the fridge, essentially the freezer, that you can use it. So you have to be thoughtful and planful about how many you're going to go through. So we couldn't say, okay, I want 10,000 and hope that they're going to give it to us, because we couldn't possibly give that many, nor could public health. So right. That's how we do that. Someone had asked, which is a really good question, is Walgreens vaccinating or any pharmacies? I know Walgreens is. I've heard Walmart is, but I don't know that. I think it's the same situation. They have a limited amount. The pharmacies are getting their doses directly from the federal government, so they're not going through the state. So, keep an eye out, go on to Walgreens, website and see what you can find out. I haven't heard if it's arrived here in town as yet. For Walgreens, we know that it has. Okay. They're receiving 100 doses a week. So it's not many, but it certainly helps. And as you said, it comes from the federal government, so it's not impacting our allocation, what they get. What I was told today on a call with the county is that Walmart has also applied under that same program, but they have not started receiving vaccines yet. Okay. Shannon asks, if one already has had COVID, are both doses necessary? Really good question. The answer is yes. At this point, we're still recommending both doses. And someone else had asked, I'm going to just kind of rapid fire through these. What symptoms can a person experience after the second dose? I'll just do a shameless plug. If you go on to DCMedical.org, or on YouTube, we have a video that we've created that talks about side effects, what you can possibly expect. About 30% or so of people after their second dose mostly are having symptoms that can include things like body aches, fever, chills, kind of feeling crummy. It lasts about 24 hours, and some people will describe it as being down and out. And so the side effects are definitely there. In fact, what's interesting about it is, when you'll hear people say, I got the flu from the flu shot, we used to always say, well, it really wasn't the flu, it was your body ramping up. You do feel the way you feel when you're sick because of what the body is doing to fight off the bug. And that's what we're seeing. So that's something that you can experience. Also, what's important to know is if you get it, and if you get the second dose or the vaccine and you have no side effects, that doesn't mean it didn't work. That just means that for whatever reason you didn't happen to have the side effects. And again, it really isn't a side effect. It's what your body's doing in response to ramp up that immune system. Great example, sitting right here at the table. I had nothing. Brian had pretty significant side effects.
Yeah, of course, my wife will tell you I'm kind of a baby.
Well, it's the man flu.
Yeah.
It's the man flu thing, so
I walked the dog the next morning after my second vaccine, and then I had to take a 3-hour nap. But maybe that's just me.
Isn't that's like a normal day for me?
Yeah.
Anyway, so.
But it is important to consider that though from a planning standpoint, particularly if you're still of working age and you have something important going on at work the day after your second vaccine. That's something that you need to take into account. We've had a number of employees here at the medical center who have had to take that day off after the vaccine. So it's something to just keep in mind.
Have we seen any serious negative reactions to the vaccine? Thanks, Mary, for that question. No, we have not. We've had, I can think of a handful, probably less than on one hand, of people that have had the vaccine, felt funny. Some went to urgent care, a couple went to the ER to be looked at and evaluated, but nothing came of it. It was just they sort of felt funny. And again, it's amazing how, kind of, if you think of it, the funniest we feel as people generally is when we're sick. And as I mentioned a second ago, a lot of that is what the body's doing to us to try and get rid of a bug or an offending intruder, shall we say. So you feel awfully funny, and for some that can be really scary. And so, we always make sure that we evaluate those. But it's one of the reasons why we have people sit around for 15 minutes following the vaccine, because if anything's going to take place, it generally happens in that time frame. There have been no serious sort of rare side effects like you may have heard in the press, people having anaphylactic reactions, things like that. Someone had asked a second ago or earlier on in the questions, what about if you're allergic to bee stings? There's no relationship to that at all. They're really the only thing that really would let you know that you shouldn't get this vaccine is if you've had a severe anaphylactic reaction to an injectable vaccine, some other vaccine. Otherwise, there's really nothing. This is not like flu shots. There's no egg product. There's no preservative in this. So there's nothing that would prevent you from getting the vaccine.
I know our team has been extremely cautious about this. It's part of the reason that we conduct our vaccines right across the hall from the emergency room, not because we're expecting problems, but just in case something were to arise, the emergency room and that team is right there. And then the other thing I've heard is that, if a patient has a concern about a possible reaction, or if a patient had a slight reaction on the first vaccine or something like that, we are having people wait 30 minutes at times. So if you feel more comfortable waiting a little bit longer, knowing you're right across the hall from an emergency room, that's fine. Our team will certainly understand that.
Absolutely. Molly asks, realizing you can't speak to specifics, is the vaccine safe for pregnant women? That's a really good question, and I'm going to do what every good doctor does. I'm going to punt that, and I'm going to say that you should ask your OBGYN. But in all seriousness, that's true, you should. But the reality is what the American College of Gynecologists has come out, they've come out with a statement that essentially says, look, if you're pregnant and you get COVID, you are at far greater risk for a bad outcome. So you're better off getting vaccinated even if you're pregnant. But again, if you are pregnant, it's one of those things where you want to have that conversation with your OBGYN. I've been practicing medicine for over 20 years, and when it comes to treating people that are either pregnant or that are breastfeeding, I am forever dialing a friend and calling my OBGYN friends because I don't trust my own level of knowledge when it comes to that sort of thing. But generally, yes, you should be fine to get the vaccine. Let's see. If we have had the vaccines and we experience reactions, does that mean the virus is in our bodies? No, good question. That does not mean the virus is in your bodies. What essentially the vaccine does is it introduces a little short strand of what's called messenger RNA that gets, and RNA codes for a protein, basically. And what happens is it gets into the cell machinery creates the protein, and that protein looks just like one of the spikes that's on the outside of the coronavirus. You've all seen pictures of that little ball with the spikes all over it. It looks like a crown. That's why they call it coronavirus. And that fake spike protein that is created by that messenger RNA, the body sees that and says, whoa, haven't seen that before. I better go and attack that and get rid of it. That act of attacking that and getting rid of it is what you're feeling. So it's, again, the body's inflammatory mediators. They're called cytokines. Some are called interferons. All kinds of different things that go and try and do that. So the beauty of it is that once the body has seen that on a fake spike protein that's made to look just like the coronavirus, if your body sees the real coronavirus, it already knows what it is, and it goes and attacks it.
It's amazing. I mean, it's been an amazing discovery.
Oh my God,
and
yeah, it's.
I think the science holds a lot of promise for a lot of other types of conditions as well.
It does. I mean, this is the messenger RNA thing has been under good, pretty extensive research and studies since I think 2005, and what we're seeing with vaccines is very similar to the biologic medications we're seeing in cancers and things like that, where actually the body is, we actually are giving messenger RNA to code for a protein to go and deal with a cancer at the cellular level. So it's kind of neat. I mean, how we can create something that you can't even see. Mm-hmm. It's just amazing to me.
Yep.
Are we educating the public on the importance of receiving the vaccine, or do you stay out of the politics? Good question. As I'm stammering. I don't think the concept of vaccination is political at all. I mean, I think there's really good science behind vaccines. If you think about the number of lives that have been saved over the course of history, all the different, starting from smallpox and then moving all the way down, all the diseases that hardly or don't exist anymore. So we absolutely encourage people to get vaccinated. There's really no good reason not to, except for those few cases that we talk about. But generally speaking, it makes absolute sense. And the bottom line is, if you are inclined to disbelieve or if you're inclined to be suspicious, there's not much I'm going to say to you that's necessarily going to change your mind. But it doesn't mean I won't try. So.
I think the unique thing, there's a lot of unique things about this situation compared to other vaccines, but one of them is that there are real tangible benefits to receiving this vaccine. Mm-hmm. So for instance, the CDC came out last week with a statement saying that if you've been fully vaccinated and you're exposed to someone who has COVID-19, you don't need to quarantine. Just those things alone, have the ability to keep us working, have the ability to end this pandemic for all practical mm-hmm. purposes. And so beyond the scientific benefits of getting the vaccine, there's going to be some real societal benefits to getting it as well. And so I completely agree with you. We don't think it's a political issue at all, and we encourage it.
If you don't get any reaction from the first dose, can you still get a bad reaction from the second dose? Yes, you certainly can. I mean, it's possible. In fact, just anecdotally, what we're seeing is most people do just fine on the first dose, and the second dose is when they have their side effects. People that have had COVID previous and have recovered from it and get the vaccine, we've seen people that have had worse side effects with the first vaccine, and the second one isn't as bad, which again, to me at least, makes sense because once again, the body has seen it. If you've had COVID, the body has already seen it, and so once it sees it again, it really, it rallies the troops to go in there and deal with it, and so that again is what makes you feel crummy. Have we received guidance on when the population at large is likely to be able to openly receive the vaccine? No, we haven't. In fact, literally what you've heard us talk about this evening is what we know. I mean, we are being, and I'm not even sure that the state at this point knows when that will be. I think everyone is using we're using the information, the data in front of us to make decisions from week to week to week. So it's not that there's some grand plan that someone knows. I don't think anybody has. I think there's a grand plan, but as far as when these steps are going to take place, we have to wait and see what the supply is. I'll just throw out there an additional fact, and that is that the third vaccine made by Johnson & Johnson is going this week for its emergency use authorization hearing, if they call it a hearing. Assuming that that goes through, which I kind of imagine it will, that'll be a third vaccine to enter the market, and that should positively impact supply as well. And that works on a different mechanism than these first two do as well. We'll probably create some kind of video content that goes through that as the time gets closer. But what I'll say right now is, as I said a little while ago at the beginning, when it comes to the vaccines, people have asked me, should you get Pfizer or Moderna? It's going to be the same thing with Pfizer, Moderna, or Johnson & Johnson. Get what you can get, and when you can get it is basically the answer. Some people have seen that the press has indicated that the Johnson & Johnson is about 65% efficacious. And so they've said, well, wait a minute, the other ones are 95. That really stinks. And it's I sort of chuckle a little bit at that because the average flu vaccine, if you're at 45 to 50% efficacy, you're doing well. So 65% is really good. And by the way, 65% is for all disease, period. If you're looking at moderate to severe disease, that's 85%. Moderate to severe disease, those are the ones that cause hospitalization and potentially death. So even if you get mild disease, it doesn't really matter. You get mild disease and you move on. It's the moderate to severe disease that you worry most about.
Yeah, if any of the vaccines can reduce this to the level of the common cold, then they're successful,
Exactly.
right? Maybe we should revisit some of the eligible groups. There was a question about some of the groups that are eligible already, and then the state has put out a whole nother group of eligible folks who will be eligible on March 1st. So right now, the people who are eligible are healthcare workers and those who live in long-term care facilities, so nursing homes, assisted living, and then in late January, they also released everybody in the state who's over the age of 65. So we've said in Door County, that population, just the folks who are over the age of 65, is about 8,000 people. And right now, I believe just under or right around 4,000 of the 8,000 have received at least the first dose of the vaccine in Door County. So that's where we're at today in terms of those who are eligible. On March 1st, the following categories will also become eligible. First, and there is a priority level to this, educators and child care personnel. So that's anyone who works in schools, whether that be public schools, private schools, whatever the case may be. And it's also anyone who works in a daycare setting. And then, and by the way, the state has estimated how many people fall into each of these groups. So within the state of Wisconsin, about 250,000 people are educators or work in child care. The next group is individuals enrolled in Medicaid long-term care programs, such as family care or family care partnership programs. That's about 50,000 people in the state. Interestingly, some of those folks may have already been vaccinated because maybe they already live in a group setting or something like that. The next group is public-facing essential workers, and this is a pretty broad group. It includes 911 operators, utility and communications infrastructure, public transit, and then food supply chain, which is a pretty broad group in and of itself. That includes farm owners and other farm employees. It includes critical workers who provide on-site support to agricultural operations. It also includes retail food workers, such as employees at grocery stores, convenience stores, and gas stations that sell groceries. It also includes hunger relief personnel, so those who work in charitable food distribution centers. Another big group there, and that one is estimated to total about 200,000 people in the state of Wisconsin. So all of those folks will become eligible as of March 1st. But what the state has told us is that they generally want us to continue to follow an order to this. So they really want us to get through the 65-year-olds, and by through the 65-year-olds, what I mean by that is everybody over the age of 65 should have had the opportunity to receive the vaccine before we really start focusing on education and childcare and public-facing essential workers that I just listed there. But the good news, as I said, is Public Health is working through their waiting list. It sounds like they're going to be pretty much through that by the end of this week. We'll have the opportunity in the next few weeks to work through our waiting list as well. So I don't think it'll be too long of a wait for our folks who work in schools and daycares, but certainly that'll be coming soon.
I can't help but think, and it'd be great if this is true, that come April, right now we're all very anxious to get vaccinated. I think come April, there's a pretty reasonable chance we'll have more vaccine than we know what to do with. So I think if we can get through the next 30 to 45 days, I think we'll be in pretty good shape. I did want to answer a question that Karen had asked, which is a good one. Has the medical center used many doses of monoclonal antibodies, and has it helped? And are people aware of this treatment? For those that don't know, monoclonal antibody is an IV treatment that we give to people that meet a certain set of criteria that have tested positive for coronavirus. And so if they test positive, we have a team of nurses that call the person to give them their positive result. They review if they have any risk factors that might cause severe disease, and they will offer them the monoclonal antibody treatment. It's about an hour-long infusion. There's a little bit of time before and after, but at least anecdotally, we've seen some really good response to the monoclonal antibodies. We've had people that have felt pretty darn crummy, and the day after they've received it, they've felt a whole lot better. We'll wait to see how the numbers go. It's obviously still an emergency use authorization medication, but there's been some real positives with that. So, that is something that if you have symptoms and if you're tested and you're positive, unfortunately, then we will discuss that with you on the phone. So we're offering it to everybody that meets, there's a certain set of criteria that I can't even quote off the top of my head, but we'll offer it to you if you meet that criteria.
I know this is probably going to sound like a shameless plug, but I really do have to give a lot of credit to our physicians here at Door County Medical Center and all of our nursing staff, particularly those outpatient nurses who are working with things like the antibody treatment. Every little thing that's come along over the last year that's come out that helps the situation, that helps patients who have been infected with this coronavirus, our physicians have been right on top of it. And the antibody therapies is a great example of that. When, right away, they determined the possible effectiveness of this, and they worked with our pharmacy to make sure that we could bring it in and start providing this treatment right here locally so that patients wouldn't have to travel for it. And it's been fantastic for our community.
Mm-hmm. And I'll tell you, that's been one of the neat things about working in a smaller hospital is that our ability to, and again, this sounds like we're sort of bragging on ourselves, but after a while you sort of do, because you're really proud of the work we've done, and to be able to a bunch of the nursing leaders and frontline nurses that have gotten together and said, okay, here's how we can make this work. It's amazing how we've been able to do this right from the beginning. I mean, so it's been really cool, and I have a lot of friends that work in larger hospitals in the cities and things like that, and everyone's done the best they can, but we've done it just a little bit better, I think. So.
I did notice one piece of fine print in reading through the eligible populations that I just wanted to circle back to because I know it's particularly applicable here in Door County. But all staff who work in Boys and Girls Clubs and YMCAs also fall under that educator and childcare list. So that's something, if you're an employee here of the Door County Y or of the Boys and Girls Club, know that you will become eligible March 1st. Again, just like everyone else, you will have to wait for the supply of the vaccine to come in before we can actually get you vaccinated, but you will become eligible soon.
And as Brian is adding those comments on, I'll see there's a lot of individual questions of people saying, what about someone who is an organ transplant recipient and is not yet 65, and different specific things. What we've told you is basically the way that we're told to go. Is there really are, there's not a lot of small exceptions. In fact, I don't think there's any small exceptions. It basically is, these are the groups that we're going on, and that can be frustrating. But that's kind of the way that it is.
Yeah, that's a good point. That's one that's been frustrating to us. I know we've had those conversations of, we know those patients who trust us for primary care, who are just under the age of 65, but deal with multiple chronic conditions and can really use this vaccine and this coverage. And we're just not able to provide that at this time. We do have to wait for the state's guidance on that. So just know you're not alone when you have those thoughts. We second guess things too, but at the same time, we want to make sure we maintain our eligibility to continue to provide this service in the community. And the way you do that is by following the state's rules on this.
Here's an interesting question that I'll kind of throw toward you. Julie asks, do you know why those on Medicaid are eligible before those on Medicare? Asking because many that are disabled are not 65 and are on Medicare.
I don't know the answer to that. I know it's a pretty small group when you talk about the individuals enrolled in the Medicaid long-term care programs, such as IRIS or family care or those sorts of things. But no, I do not know why those are differentiated as opposed to those who have disability and are on Medicare.
I'm glad I threw that to you, because I would have answered that totally wrong, because the way I took the question was, payer, if you're Medicare and Medicaid, does it make a difference? And the answer is it does not, but you got a more complete answer. I assume that's where the question came from.
I
think that's right.
That new group that's coming out, but yeah, I'm not sure.
Okay. I think I'm going to look through here. I think we've gone through a lot of the questions. Morgan asks, are librarians in the educator group? I do not know the answer. Any sense of?
I should probably read through the fine print. Again, this came out at 5:15 today, so I haven't had a chance to look through it completely. But my reading in it, and this bullet point says, all staff in regulated childcare, public and private K through 12 school programs. To me, that means any employee of the school district. That's how I would interpret that.
Okay, and this is a really good time to call it quits, because my computer just died. The battery died. So, and we were ready to wrap it up anyway. So, I want to thank everyone so much for your insightful and thoughtful questions. It's always a pleasure to come on and do our best to try and answer whatever questions we can, because again, our goal here is to keep our friends and neighbors as informed as we possibly can, and trying to do that in multiple different ways. What I'll leave you with is a thought I had a while back about vaccines, and I probably shouldn't preface it by saying this, but that's just how I am, is this might be a little saccharine, but the way that I look at the whole vaccine situation is this. We started with COVID-19 over here, the horrible pandemic began, we're all suffering, and now here we are with the vaccine. And we got on the train here when COVID started, and that entire train started to move toward the end with vaccines. We're all on the train. We're all moving forward. There are some people that have gotten vaccinated, and they might be in the first car, and as the vaccine cart makes its way down through the train, it'll eventually get to the last car. But the entire time that we're waiting for that, if you're in that last car, we're moving forward. So we're moving toward herd immunity. So to whatever degree that may help as you're waiting anxiously to get your vaccine, we're all moving forward to a point where we can get back to some degree of normal. So hope that's helpful.
Well, I mean, to your credit, you've been saying that for weeks, and I think we're starting to see that play out possibly in the numbers. I mean, it's impossible to know for sure, but what we know is nationally, regionally, and even there locally, we're seeing a large decrease in the number of positive cases. And I think it's that train moving along that you've been talking about for weeks.
Yep, hope so. Brian, thank you so much for joining us. Really a pleasure to have you.
Thank you. Can I give one final thought?
Please.
The only final
Absolutely.
thought that I had is just to point you back to some resources. And we mentioned them, but I just wanted to end with them again. On our website, we have a feature called the Vaccine Corner. That's always a place where you can get the latest information, both what's going on in the community from the vaccine standpoint, but also here at Door County Medical Center. The Door County Public Health website as well. Again, they put out a press release today saying that they're going to be reopening their waiting list. And so I encourage you to go on to the County of Door COVID-19 page and look for that link for that waiting list and get on that as well. And then the other thing that we've said is that, we're not competitive about this. So we want people to get the vaccine as quickly as they can, however that they can get it. And so, for instance, we know that there's a large mass vaccination site down in Green Bay at UWGB that's run by Prevea. And the way that you schedule for that is through the My Prevea app. And so if that turns out to be a faster way for you to get the vaccine than from here at Door County Medical Center or at Door County Public Health, we encourage you to do that. We want you to explore all of those resources.
Absolutely.
So, thanks for having me.
Absolutely. Thank you so much. Thank you all for joining us, and we'll talk again soon. Stay well.